it's Lisa with Accelerated Nursery Training, and I want to show the skill Bedpan. It's been updated, so I wanted to give the new updated version of it. So the supplies are different. So we need a bedpan, wipes, toilet paper, gloves, a towel, and a disposable chuck. And you also need a bath blanket to keep your resident warm. Let's get started. So I'm gonna wash my hands. I'm gonna knock. Hi, Miss Victoria. This is Victoria. This is my student. She's going to demonstrate being a patient, and then I also have other students filming for me. So thank you guys. Hi, Miss Victoria. My name is Lisa. I'm gonna be your CNA for the day. How are you doing?
I'm doing good.
Good. I'm glad to hear that. I understand you need to use the bedpan. Is that correct?
Yes.
All right. I will get that started here in a second. I'm gonna do some safety checks real quick. Okay? Make sure your bed's in low lock position. Your call bell is within reach. I'm going to put over on this side for you. Don't drape it across your resident because you don't want to choke your resident. All right, and you have your remote for your bed too. All right, and then I'm going to get some privacy here. All right, so if you don't need anything, I'll be right back and get my supplies ready. You good? All right. So I've touched all that equipment. I'm going to wash your hands. I'm going to grab a barrier. I'm going to place this on my side table. Do not put it on your over bed table. This is where they eat. We don't ever put anything that with elimination that goes on a table that you eat on. So this is going to go on the side table, and I'm going to gently open it up. I'm not going to fling and fling it. Gloves. I'm going to grab my bedpan, my wipes, toilet paper, and a peri pad. Alright, so I got toilet paper, wipes, bedpan. I'm also going to grab a bath blanket and a disposable chuck. I get all of my supplies together at one time. And you can stack them on this like you need if you need to. So I'm gonna go ahead and get my gloves on. I got an extra pair of gloves. I'm gonna place my bath blanket on my resident. I'm gonna ask permission. May I place this blanket on you? This is gonna keep you warm and maintain your privacy.
Yes.
All right, gently place it on her. This will keep you nice and warm, and we won't see anything we don't need to see, okay? Okay. Do you mind holding this top blanket for me? All right, and I'm gonna pull this sheet down. Okay, ready? You can put it down low to keep you nice and warm and privacy. Just bring it down to their knees. All right. So now, I'm gonna place my peri pad, and I'm gonna I need to place it on her so I can visualize where it needs to go. May I place this on you so I can visualize where it needs to go?
Yes.
All right. And you open it up. I'm gonna roll it halfway to me. Okay. And then I'm gonna place it under here. And the resident can lift her hips. So I'm gonna have her lift her hips, and I'm gonna place it up underneath there, okay? Do you mind lifting your hips for me so I can place this underneath you? Okay, I'm gonna stick it underneath there. I'll need to go on the other side to make sure. And we also wanna make sure that gown isn't in the bedpan itself. All right, you mind lifting your hips again, ma'am? That gown is all tangled in it, so you want to make sure that it doesn't get tangled into it. Okay. All right, so we have the disposable chuck in place. Now I'm going to put the bedpan. Okay. And you want to place it the wider angle on the buttocks. This is the lower for the urine. This is basically for stool. Okay. Let's go ahead and lift your hips up. Thank you. want to make sure that gown is not stuck in there, okay? Correction, I need a second pair of gloves. I will grab those too. All right, go ahead and lift your hips again. There we go. I'll make sure that gown wasn't there. All right. I'm gonna go ahead and give you your call bell. And I want you to raise your head up if you don't mind. Okay, and just raise, right, that one up there. All right, so I'm gonna step out. I'm gonna give her some privacy. I'm gonna give her wipes and her tissue and the trash can. Instruct her to use the wipes and toilet paper and place them in the trash can. I'm gonna go ahead and remove my gloves, and I'll also get my second pair of gloves after I wash my hands, because there's my correction. All right, I'm gonna wash hands. I'll grab a second pair so we're ready for when we come back. All right, Miss Victoria, if you don't mind, when you are finished, if you'll ring me, and I'll come back in here and we'll take you off that bedpan, okay? All right, I'm gonna rewash my hands. She has rung, so I'm going to go ahead and remove this bedpan from her. I've washed my hands. Of course, I knocked on the door. So you all done, ma'am?
Yes.
All right. Let me get my gloves on and I'll assist you. Did you have to use the toilet paper?
Yes.
And did you use the wipes? Maybe you do the wipes and wash your hands and make sure they're clean right now. And then I'll have you lower your bed. I'm going to go ahead and take this from you. Place it over here on my side table. All right, your trash is right here. Thank you so much. All right, go ahead and lower your head down, please. So I'm gonna go ahead and I'm gonna remove that bedpan. The new technique on removing the bedpan is you're actually taking that disposable chuck and you're covering the bedpan as you pull it out, and you're placing it on your side table and keeping it covered to maintain privacy. The old skill had another towel and you would cover it. This, well, you just take a peri pad and cover it over. Okay? I'll have you stand right here and we'll visualize it. Okay? All right, ma'am, if you do not mind lifting your hips up. Okay, I'm gonna grab this pad. I'm covering it and I'm pulling it out. All right, you can go ahead and lay down. All right, so we're nice and covered. I'm gonna place it on the table right here. All right. Make sure her gown is dry, didn't get wet from any kind of elimination. All right. I'm gonna go ahead and empty your bedpan. Is there anything I can get you? Is the temperature still okay, warm in here?
That's fine.
It's fine? All right, maybe afterwards we'll get you a magazine and get you a Dr. Pepper or something. You can watch Oprah. Sound good?
Mm-hmm.
All right. All right, let's go ahead into the bathroom and empty this bedpan. All right, so now when I take this to the bathroom would be right here, and I would drop this in the trash, okay? And then I go into the bathroom. Okay, I'm in the bathroom, and I'm going ahead and empty this waste in the toilet. I'm going to dump it in the toilet. I'm going to place it on the toilet. I'm going to grab a towel, and I'm going to hold my device, just like any of our other devices, we hold it with the paper towel, okay? I'm going to get another towel and I'm going to turn my water on. Dispose of that towel. Alright, so we're going to rinse it, and we're going to dump it in the toilet. Rinse. Dump it in the toilet. 3 times. Dump it in the toilet. I'm going to get a new towel, turn my water off. Correction, I failed to flush a toilet. So get a new paper towel and flush a toilet. Get a new towel. I'm going to clean the inside of the device, the bedpan. And just clean 1 towel for the inside and 1 towel on the outside. If you need to use 2 towels because it's wet, then go ahead. But if it's any kind of wetness or anything, you just want to make sure it's dry. All right, and then I'm going to have another towel. This is going to open my drawer, pick up my supplies, and close my drawer. This towel never leaves my hand. Let's go back in there. All right, so I have my bedpan and I have my towels. I'm going to pick up my supplies. I'm going to pick up my toilet paper. I'm going to pick up my wipes. I'm picking my extra glove. I'm gonna toss that in the trash. All right, I'm gonna open the drawer, the third drawer, and place this in that drawer. The new towel shuts the drawer. Both towels go in the trash. In the same manner, take your gloves off. Okay, and I'm gonna wash my hands. Okay. All right, Miss Victoria, I'm gonna go ahead and remove this bath blanket and get you ready to watch Oprah. Sound good?
Yes.
All right, so I'm gonna go ahead and roll this. I'm gonna tuck it under. Roll it back. Trying to still keep her privacy and maintain her warmth. Come on, put your hand underneath you. You're all wrapped up in this. She was wrapped up like a cocoon. Okay, I'm gonna bring it up, not to her, on her face or her neck. I don't want to choke her, but I'm gonna take this towel or this blanket. I'm gonna roll it, trying to keep her covered up. And you want to roll it in a nice little ball. No flingins. We're gonna place this on our barrier and get rid of it. I'm gonna place it on the barrier. I'm gonna roll it away from me. Place this in my linens. We are basically complete with our skill. I'm gonna make sure our residents are nice and pretty, wrinkled free, do a safety check. All right, Miss Victoria, I'm just gonna straighten out your sheets for you. You're comfortable, warm?
Yes.
You want that Dr. Pepper now?
Yes.
All right, we'll have to go get that Dr. Pepper.
With the lime.
With lime?
Mhm.
Even perfect. Okay, I'm gonna make sure your bed is lowest locked position. Your cowbell is right there, still on your left-hand side. And would you like your curtains open or shut?
Open.
We're gonna open them? All right, so we're gonna go ahead and open. All right, well, I think we're all done. I'll go get that Dr. Pepper. Thank you for letting me take care of you. I'm gonna look around, make sure I got everything. I've done everything. I know she doesn't have a disposable chuck underneath her because I took it and I covered that stool. I'm gonna put her table back where it belongs. Leave your room the way you found it. I think I'm all done. All right, I'm gonna wash my hands and I'm gonna say skill complete. Thank you for watching.